Hi everyone, this is Valerie Craig, Speech 2, National University. As a nurse, a big part of my job is patient teaching. And in regards to sex education, I have come across so many people who do not know how to have safe sex. Perhaps it's because growing up, no one really wants to tell you how to have sex. Instead, the focus is to instill fear, so you don't. But it is inevitably a part of human nature. So, since sex cannot be prevented, the best way to protect our children and ourselves is to be prepared and educated. Today, I will be providing a crash course in health, including instructions on safe sex practices, with a particular emphasis toward our teenage children, as well as some information on the most common STD in the United States, the human papilloma virus, HPV. There are, medically, two possible outcomes of having unprotected sex. They are 1. Contracting a sexually transmitted disease, also known as an STD, which today the medically preferred term is sexually transmitted infection, or STI. And 2. Pregnancy. The best way to prevent contracting an STI is first to learn about them. STIs are spread through bodily fluids. This includes oral, anal, and vaginal sex. Some STIs can even be spread by kissing or skin-to-skin contact, such as the herpes simplex virus. Another route is from mother to child. In this case, the mother is already infected and gives it to the baby. This is referred to as vertical transmission. The most common STI in the United States is the human papillomavirus, HPV. According to the Center for Disease Control, or CDC, 79 million Americans are infected with HPV, with 14 million new cases each year. And they state people who are sexually active will have come in contact with the virus at some point. There are different types of HPV. Some strains have a mild effect, while other strains are more serious, causing up to 27,000 different types of cancers, with cervical cancer being the most common in women, and oropharyngeal cancer, which is the very back of the throat, base of the tongue, and tonsils, being the most common in men. HPV can lead to secondary STIs. Secondary just means caused by something else. And it could also lead to sterility in women via a condition known as pelvic inflammatory disease. In 2013, the CDC did a study on young people between the ages of 15 and 24 years old, infected with related STIs. The results recorded 100,500 infected with chlamydia, 15,400 infected with gonorrhea, and 750 infected with syphilis. If these numbers are shocking, the numbers for the adults infected in the 2013 study were much higher. These statistics validate the need for individuals to be properly educated, as well as a serious public health matter. Now that you've gained some insight on sexually transmitted infections, you can take the necessary measures for prevention. There are several ways to do this. The number one absolute way to prevent getting an STI is to remain abstinent. This, however, is not an ideal solution. The condom remains to be the most frequently used prevention tool. A condom should be applied before engaging in oral, vaginal, or anal sex. When applying a condom, excuse my friend, you should begin by leaving slack at the tip of the penis to receive the semen during ejaculation. A tightly fitted condom is an impaired one and subject to break. Once slack has been left, the remainder of the condom should be rolled down the shaft of the penis. Condoms that contain spermicide do not kill STIs, it just prevents pregnancy. And condoms made of lambskin are too fenestrated or porous to prevent STIs, and they're not recommended. Condoms have only been proven 85% effective, and they are not meant to be reused. The diaphragm is also known as the female condom and should be used before engaging in sexual intercourse. A diaphragm must be fitted by your doctor for proper protection and refitted in the event a woman or young lady gains or loses weight or after becoming pregnant. It is very important that the diaphragm remain in place 6 hours after engaging in intercourse to ensure effectiveness. Using the female or male condom requires a lubricated environment for protection and to prevent friction. So in the event that lubrication is lacking, it is recommended to use a water-based KY jelly. Oil bases such as lotion and petroleum will weaken the latex. To be protected during vaginal oral sex, it is recommended to use what they call a dental dam. This is the expensive version. The cheap version, saran wrap. Vaccination is also an important aspect of prevention. The HPV vaccine Gardasil is a 3-series injection over 6 months given to young people beginning at the ages of 11 and 12, up to 26 years for females and 21 years for males. It is preferable not to have been sexually active prior to receiving the vaccination so that you are free from infection. Getting frequently tested is just as important as any other measure you can take to be safe. If you are sexually active with multiple partners, it is recommended that you get tested every 6 months. Those in a monogamous relationship should at least get tested annually just to be safe. After all, to err is human. Given the statistics, it can be deduced that the rate of young people becoming sexually infected is only going to climb unless we as adults, parents, educators, and healthcare professionals are active in advocating safe sex education and practices. The idea that you can use fear to stop someone from engaging in sexual intercourse is not only naive, but is an inappropriate approach. It is only normal for humans to want to have sex. The best insurance we can give someone is to teach them how to be safe in the process. Abstinence is by far the surest way to prevent getting an infection. Other modes of safety include condoms and diaphragms with the use of natural or water-based lubrication, dental dams, vaccinations, and mutual monogamy. Please remember that getting tested is just as important as taking measures to prevent getting STIs. So be adamant about it. In closing, I'd like to leave you with a personal quote of mine. Education breeds stronger minds, and stronger minds make better decisions. Thank you.